So we're going to look at Hannah's leg, and we're going to show you a little bit how you can start to treat an Achilles tear, and this will relate to other tears and ruptures as well, depending on which week you're on. So Hannah, which week are we on this week?
It's 9 weeks today since I did it.
9 weeks today. What we've been doing is we've been working on Hannah's back and whole body to loosen it up for her golf. But we won't be showing you that today because we don't want to take too much time. And then we've been working on the leg above the injury. Now, you never work directly on the injury because the body's setting up a scaffolding which is going to allow that muscle to repair. So in the first few weeks we leave this area completely alone, but because this area is obviously taking a lot of strain and the other leg is having to support you because you're leaning a lot on this, we work on that as well to prevent strain on this leg. So just to show you, we'll put some oil on. So today I am going to work very lightly on the injured area because we're on 9 weeks, but I'm not going to dig in. So let me show you. We're going to warm the muscle up first. So if you want to know what treatment you should be getting if you've damaged the Achilles, really you should be looking in the first 5-6 weeks of your therapist or your physio or your masseur just working above the injury, and then 8 to 9 weeks we can start to warm up the whole area very gently. Just get some blood flow into that and warm the muscle up. So once we've done that, what we're then going to do is we're going to drain the system. We're going to get rid of any waste products through the lymph nodes. So we're just going to gently squeeze. And what this is going to do is going to release any waste products that have built up in the healing time. The body will send a lot of chemicals to that damaged area. They don't always flow away as effectively as they should do. Think of a drain and you're just trying to flush it out. So we're going to do that very gently there, but I'm not going to compress on the damaged area. I'm just going to very gently just work upwards. In 3 or 4 weeks time I will do it here, but for now it's just above. So I take the damaged area. So we're on 9 weeks, so we're going with the flat of the hand. We're not pushing in with the thumb or the fingers. And we're gradually releasing this. Now, Hannah's recovery has been much quicker than the other person we've put on the site for you, on the social media site. And the reason is because we've increased the blood flow to the area, which means it's going to heal quicker. We want to encourage blood flow without damaging the area that's repairing. So we're working across the myofascial tissue, which is above the muscle. We're just getting that more pliable, just so that we can increase the blood flow to that area. And because Hannah's on 9 weeks now, we can just very gently support that there. And we can very gently work down the calf as well. And then finally, if you're going for treatment, you can get them to go deeper into the muscle tissues using the thumbs and the fingers above the damaged area. So what we're doing now is we're realigning these muscles above the damaged area. We're getting those as strong as possible to support this area. And again, we're increasing blood flow and we're increasing pliability of the muscle. We can also work across the grain of the muscle. But again, I'm not doing that yet on the damaged area. But what I'm doing on this leg, I'll be doing on the support leg as well. Because remember, although this isn't damaged, you're going to be putting increasing amounts of body weight on the good leg while the damaged leg is healing. Now what often happens is people do that, this gets tight, and then that leg goes. And with Hannah, what I will do over, say, an hour, I'll work across the whole body, so we'll loosen the back out, work the glutes out. But for this video I want to show you directly what we're doing on the leg. So let's go through it stage by stage. We've warmed it up. In the first 5-6 weeks we won't go near this area, but we'll warm up this and we'll do the whole of the other leg. And then we'll drain it on both sides. And then from say 6 to 10 weeks, very gentle work with the flat of the hand on the damaged area just to increase the blood flow around the muscle. And then finally we'll go in, get right in there with the thumbs in the muscles that haven't been damaged, realign them, get the blood flow going. And then in the next video we're going to show you the little exercises that Hannah's doing with the TheraBands just to start strengthening this area.